That's exactly the arc of this session, is to reverse things a little, not put all the burden on the consumer, to make changes, just having the whole logic go from dietary guidance to consumer choices and feeding back through the food chain, but instead thinking how in environmental issues, it's very important to think about how resource scarcity and environmental consequences of production affect food prices, work their way through the food system, both to the food manufacturing industry, and we've just heard about the perspective from somebody with experience in the restaurant industry. And now we're talking about how consumers respond to these economic incentives, including prices and income. Here's what I'm going to talk about. First is there's a substantial literature on how economic incentives affect the healthfulness of people's choices, and we'll spend a little bit both on the general population, and then because when we raise prices, there are special issues for low-income Americans, we'll talk about low-income populations. And we'll think about whether there's any analogies in this long experience thinking about incentives for healthy food choices when we turn our attention to economic incentives for environmental food choices. And I'll spend some time talking about similarities, but as I was preparing the talk, found myself reflecting more on the differences, on things that we need to think about differently when we shift our attention from health issues to environmental issues. And we'll close with a discussion about interactions between economic incentives for health and for the environment together. A topic that's come up already in the morning session has been on which food choice issues do environmental goals and health goals seem to be consonant, and on which ones are there difficult trade-offs for us to make. So healthy incentives first. We've had a lot of discussion about what's healthy in the first place. This is the federal government's My Plate guidance, which you all know well, and as Kathleen pointed out this morning, the thing that strikes you immediately is what a high fraction of the recommended plate comes from plant foods, such as fruits, vegetables, and grains. This is the federal government's Dietary Guidelines comparison of different categories of food to current consumption. So 100 here means you're consuming exactly the recommended amount in a particular food category. Higher than 100% means you're consuming more than is recommended, such as solid fats and added sugars. And what stands out immediately is that foods like fruit, dairy, beans and peas, and vegetables, we could consume substantially more and have healthier diets. And one of the more complicated ones to think about is meat. And so USDA doesn't look at this and say, eat less meat. Somewhat more delicately, you could think of this in terms of having some space to reduce meat consumption before the mainstream dietary guidance folks worry that you're not getting enough. So when you talk about consumer responses, the main tools that economists rely on is an elasticity. And elasticity is just a way of describing how much people respond to different things in their economic environment. So for example, an own price elasticity is the percentage change in the quantity somebody purchases of a good, we'll call it good A, in response to a 1% change in the price of that same good, good A. And a cross-price elasticity is useful for thinking about how the price of one good affects consumption of another good. So it's the percentage change in the quantity purchased of good A in response to a 1% change in the price of good B. And I only go over that in order to give you some grounds for interpreting some of the research results that I have to share in a couple moments. But as you read about these elasticities, you might ask yourself, well, what elasticity is good? Do we want them to be big or small? And the answer is, it depends. If you want to use a tax on good A to reduce consumption, for example, cigarettes, then you want a large negative elasticity. Taxing something with a large negative elasticity is what you're looking for. But if you want to use a tax on a particular good in order to raise revenue, then the way public economists look at things, it's better to tax a good with a low elasticity, a small elasticity. If you tax something with a large elasticity, people reduce their consumption as you're taxing it, and it's like squeezing the goose that's laying the golden egg. If you're seeking to raise revenue, you want a goose that keeps on laying, and so you want something with a low price elasticity. And where do you find these elasticities? You know, the literature is complex. The Economic Research Service has kindly organized a lot of the literature into a nice online database where you can pull down your options by menus that you choose. For example, the United States, beef. You want to look at the cross commodities with chicken, pork, and so forth. But these elasticity estimates have also been making their way into the public health literature. So here's of the many articles that I could have quoted from, here's an example in the American Journal of Public Health by Andreeva and her colleagues at Yale University, and it gives you a sense of the range of own price elasticities for several products. And the interesting ones to look at include, for example, a meat product like beef. This means that if you raise the price of beef by 10%, the consumption will fall by about 7.5%. So that's not considered highly responsive, but it's nothing to sneeze at either. It's substantial consumer responses to the price incentives around them. Substantial consumer responses. Soft drinks is the really interesting one because there's a long literature in economics that's kind of skeptical of using price incentives to affect the healthfulness of people's choices, and a lot of that literature focused on snack foods. And I would say the level of optimism among my colleagues in economics has been going up in recent years on this particular issue, and part of it depends on which food you look at. So if you look at soft drinks, first thing is this average elasticity of 0.8 is you know, a moderately sized elasticity, but also I think the more recent estimates are at the upper end of this range. So above unity, you know, an elasticity of 1.2, meaning that if you raise the price of soft drinks by about 10%, the consumption might fall by about 12% in some of the recent estimates. Soft drinks, you know, these elasticity estimates are controversial, and using them to design public policy is complex. And one of the things that people do is, one of the counter-arguments against using a tax on soft drinks, for example, to affect the healthfulness of choices, is to think about what might people consume instead. So here's a table from a report by the Economic Research Service that shows both the own price elasticities and the cross-price elasticities. So if you raise the price of caloric sweetened beverages, meaning mainly sodas, by 1%, you see that the consumption of caloric sweetened beverages falls, just as you might expect, by perhaps 1.2 or 1.3%. The consumption of some other things is going to increase, for example, juices. So you're gaining back some of the calories in juices that you lost on the soda, but it's not enough to make this a bad proposition from a health perspective. You know, it only partly offsets the nutritional gain that you get from reduced calories from the caloric sweetened beverages. So what are the implications? One thing people talk about is taxing less healthful products, foods or beverages, but this is difficult in the United States where nobody likes taxes anywhere in the world, and especially there's a well-organized constituency that's especially concerned about the growth of the government, and there's good reasons why why taxes are not popular in the United States. And so the question mark indicates some skepticism about whether this is actually something that's going to fly. Lower market prices of healthful products. If you just had a cheap food policy for comparatively healthful products, one of the things you have to think about is what incentive are you sending to the producer? Remember that you have to think about the supply response as well as the consumer demand. And especially as we turn our attention to the environmental issues from the health issues, these production responses are central to the discussion. And so if you lower the price of fruits and vegetables, that sends signals to farmers to produce less fruits and vegetables. And so that brings open the third option, which is to have the federal government subsidize the price of comparatively healthful products, such as fruits and vegetables. And here, part of the problem is just the expense. I mean, these would be expensive subsidies to create a gap between what the consumer pays and what the farmer earns in a particular area of production. And so there's strengths and weaknesses to that proposal. And one of the ones that I've been reflecting on most as I prepared this talk is not so much thinking of economic incentives as the motivation to have some commission kind of reset prices and tax and subsidize, but rather to give you the political space to entertain other things that are being done to end counterproductive agricultural policies and food policies. And we'll return to that topic in a little bit. So with prices, especially in the United States, you have to think about the concerns for the low-income population, because if on the one hand, we don't want anybody to go hungry, and we don't want prices to rise and reduce the quality of life for low-income Americans. And at the same time, we need to think about whether that particular concern means we just don't want to see higher prices for anything. Because if you wanted to suppress prices of all goods and services, you're reducing the ability of prices to send the consumers highly useful signals about what's scarce and what's comparatively less scarce, which is part of what makes the economy run, and it's part of what makes the economy run at its best performance in an environmentally sustainable way. Some things that are different as we turn our attention to low-income populations include different elasticities. People may be more price responsive if their income is low. Concern about hunger and food insecurity. We don't want to let the prices go up if it's going to increase hunger or food insecurity. And the special role of nutrition assistance programs in policy discussions about these food choices of these populations. You think of the large programs like the Supplemental Nutrition Assistance Program and the WIC program. So a number of things are being done to affect economic incentives for low-income Americans, and so this is the second panel of policy implications. The WIC package has been revised, and among the other changes, there's a new voucher for fruit and vegetable consumption using WIC benefits. The New York City proposed restrictions on SNAP use for sugar-sweetened beverages, and that turned out not to be approved, and perhaps some variation on that takes more account of the concern of the anti-hunger community might have some future as a pilot study. And then there's the Healthy Incentives pilot for SNAP, which gives a discount on fruits and vegetables through the EBT card that Nutrition Assistance Program participants use in the grocery store. And I work on the evaluation for this Healthy Incentives pilot, and the interim report is just now going through clearance at USDA, and so some early results are going to be available shortly. Not to give anything away, but I think people are going to find the results interesting, but it's not going to suck the air out of the room. It's not going to reduce people. It's not going to give anybody the sense that this is going to be the solution to obesity in America. The incentives for environmental choices. I think when we set up this particular talk, we were imagining that, you might think of this as one big analogy. If we have incentives to encourage healthful food choices, perhaps we could have incentives to encourage environmental food choices. And the more I've reflected on it, the more I'm struck by distinctive features of environmental issues. So here's some of the differences with environmental incentives compared to health incentives. One is that it may be different groups that could be incentivized. Sometimes it'll be the same foods, sometimes it'll be different foods whose increased consumption we would be encouraging. Price incentives for producers are more central to the discussion of environmental issues compared to the discussion of health incentives. And this is the one that I've been thinking about most, is that these issues are different because it's physically possible to consume unhealthy food and beverages for the rest of history. There's no feedback loop that says, no, you can't do that. And environmental issues are exactly the opposite. So let me give an example. Suppose you wanted to have some type of tax for health purposes, and you want a 10% reduction of a particular food A. So you use some elasticity estimates and you place a tax on this particular food. The purchases are going to fall by some amount that depends on the consumer response, but there's no guarantee at all that it's going to be 10%. You just do your best to forecast it and set the tax rate right, but it's not guaranteed. You think about an environmental issue where the environmental issue is scarcity. Other environmental issues have a different dynamic. But if the environmental issue at stake is scarcity, as we've been talking about with the fisheries examples, and the availability of food from a particular source falls by 10%, market prices are going to rise for that food. When the supply function shifts leftward, market prices rise, and purchases are going to fall by 10%. How do I know it's 10%? It's because you're not storing large amounts of fish from one time period to the other, right? So there's this assurance that the consumer response, whatever elasticity estimates you use are almost by the by. They're almost secondary. Whatever elasticity of response you estimate, you know it's going to be the response that makes supply equal demand for a particular product. So this makes us think about what are we talking about when we think about using economic incentives to address environmental or sustainability issues? And we need to distinguish different kinds of environmental issues. One is scarcity. The scarcity comes up in this fisheries example. Another is externalities, when food production of a particular type has consequences that aren't internalized by the food producer. This is exactly the situation where market incentives take a different fork in the road from environmental sustainability. Because on many, and let me say this as a card-carrying economist, on many issues, market incentives are environmental incentives. But when there's externalities of this type, they take different paths. And you think about water pollution in animal agriculture production, or in runoff from excessive nutrients for grain and soybean production that goes down the Mississippi and reaches the Gulf of Mexico. The way you think about setting up an incentive for consumers to change their environmental impact of their food choices is different from when we're thinking about scarcity. With scarcity, the adjustment happens almost automatically, right? Food prices go up when a resource becomes more scarce, but I've got less confidence with externalities. And a third type of environmental issue is what really amounts to information failures. For example, the consumer doesn't know what the safety is of chemicals that were used in different foods and food production. And so it's a different set of environmental motivations that come into play. So interactions between economic incentives for health and the environment. Let's take a look at this slide that we've already seen. And this was the slide from the Dietary Guidelines showing how current diets compare to what's recommended in terms of nutrition quality. And you can see clearly that some of the foods that are being underconsumed on dietary guidance grounds are ones that are very inexpensive sources, environmentally inexpensive sources of both calories and protein. And I think calories and protein are the key nutrients we need to focus on when we think about environmental impact, because the key way of acquiring many of the micronutrients is diversity. If you have a diverse diet, and you're getting enough calories and protein, in most cases you're getting enough of each of the major micronutrients. But it's the calories and the protein that are the big environmental sustainability issues. And you look at meat, and meat's been discussed substantially today. And once again, it's not to say eat less meat. It's to say that if you spend some time on public policy that in a direct and fruitful way addresses some of the environmental externalities and meat production, that you have the elbow room you need to tolerate the resulting price increases. So that if you were to address environmental externalities in meat production, and as a consequence of following new rules, the price of meat were to go up somewhat, that we wouldn't have to worry in the United States, particularly about people not getting enough protein. And the reason this is important, the reason for putting the cart before the horse, is because I think that's among the reasons, is because I think it's a more politically plausible way of thinking about price incentives and responses to environmental concerns in the United States. Imagine trying to propose in the US political context some commission that was going to tax meat in order to get us to eat less meat. And how, if you opposed this, how would you go about marshaling your rhetoric to oppose this? And you'd be able to use such rhetoric to devastating effect. Whereas instead, if you think about solving environmental externalities directly and reassuring people that we can tolerate those price increases, I think we're on much stronger ground. Still, I wanted one last reflection on the removing counterproductive policies, because I think, and this is something I don't hear people talking a lot about, and I won't talk too much about, and this isn't about belittling any particular food product, but we do have the federal government encouraging increased consumption of particular foods through a policy mechanism called checkoff programs, where the federal government sort of lends to a producer board the power to use the federal government's power of taxation to tax the producers to support advertisements with slogans like beef, it's what's for dinner, or pork, the other white meat. And most of these are not for fruits and vegetables, so there's not much use of this particular policy mechanism for fruits and vegetables. And in nutrition circles, because some of the promotion tends to be healthful meat products or healthful dairy products like low-fat milk, we're at some risk of forgetting that when these checkoff boards talk to their producers, they're very clear. It's about expanding demand overall. And so I think this would be a good time to reconsider the federal government's role in sort of promotions designed to increase beef demand. I think getting rid of counterproductive policies might have some more mileage in it than establishing some type of commission to tax meat. So what are the policy implications? I think it's dubious I think my own opinion is it's dubious to propose taxes to discourage consumption of particular foods with heavy environmental impact, but that we could reconsider policies that incentivize consumption of foods that have a heavy impact. And we could anticipate, we could use these same elasticity estimates that we were sort of vaguely hoping might lead to some tax and subsidy scheme and that we don't think actually works that well for that scheme, but we can use those elasticity and price response estimates to anticipate demand responses from policies that more directly address environmental issues. And finally, we can use nutrition assistance policy to protect household food security in the face of environmentally sound price increases. And this is a delicate thing. This is a delicate thing, imagining a world where low-income Americans have to face higher prices, and the only sort of apology that we have to offer is some strengthening in nutrition assistance programs. And yet the alternative isn't that great either, of resisting the usefulness of price increases for environmentally sensitive products simply because we don't want low-income people to face higher prices for meat. So I think on this last bullet, some balance has to be struck, but that we have to think of the nutrition assistance programs as a useful part of the toolkit as we consider what type of economy is going to send consumers the right signals about the environmental impact of their food choices. Thanks a lot.